Good evening, and thank you for joining me. I'm Joe Carbonetta, and this is Arroyo Live. This program is produced through and by the facilities of Pasadena Media. Although the effects of the COVID-19 pandemic served as the inspiration for its creation, our ever changing world continues to bring new relevance to the idea. And so it is the continued hope to help bring together and strengthen our community through informative and meaningful conversation. This program is live if you are watching on Tuesday, July 7th, and there will be an opportunity to call in with your questions or comments later on in the program. You can submit them anytime via email to arroyolive@pasadenamedia.org. The focus of this evening's discussion will be on how recent events have affected those with disabilities in the community. I am fortunate to be joined by three guests, each very knowledgeable and experienced in the field of our discussion. Miss Allie Everett, Accessibility Coordinator for the City of Pasadena, Mr. Martin Sweeney, Chair of the Accessibility and Disability Commission, and Miss Donna Pomerantz, President of the Pasadena Host Lions Club. Thank you all for joining me. I'd like to ask each of you to please take a moment to tell our viewers at home a little about yourselves. Allie, let's begin with you.
Thanks, Joe. Appreciate you having us here today. As Joe mentioned, I'm the Accessibility Coordinator for the City of Pasadena. In that role, I help to facilitate the city's compliance with local, state, and federal disability and accessibility laws. And that includes a variety of activities, one of my favorite being training my colleagues on accessibility issues and providing technical assistance, as well as providing staff support to the Accessibility and Disability Commission. I've worked and volunteered with the disability community for over 20 years in a variety of different capacities. I have my JD and MPA and Certificate of Advanced Study in Disability Studies from Syracuse University. And I feel really fortunate to be able to use my knowledge and experience to benefit our Pasadena community.
Wonderful. Martin, how about you?
Yeah, I am a Pasadena resident, District 6, and we've lived in Pasadena for almost 20 years now. And my introduction to the disability community was through my daughter's birth. I have a daughter who's now 38 years old and has cerebral palsy. And by way of her birth, we wound up in a place where we were trying to sort out, what was up and what was down. And as it turned out, we were lucky enough to sort of discover that there's a whole world of disability culture. And that sort of changed for us, moving from a medical model to a cultural model. And then from there, it pretty much just redirected my life, both personally and professionally. I then wound up shifting a career to assistive technology. And I ran a program for assistive technology for people with developmental disabilities out of the Latterman Regional Center in Los Angeles. When I found out that there was an open vacancy on the commission here in Pasadena, I encouraged my daughter to join. She sort of looked at me and told me that basically public policy was not her thing. So I decided to sort of see if I could participate and help out in some way. The one thing that you might want to put a little asterisk by my name is that I'm a parent, and that parents all have their agendas, whether they're aware of it or not. And oftentimes parental agendas are not necessarily equal to what a person with a disability might want to say. And you could ask my daughter about that. So my perspective comes as an activist, an advocate, and with the City of Pasadena's commission, someone who hopefully can find a way to take input from the community and move the ball forward.
All right. Thank you very much for being here as well. And Donna, please, if you would tell everyone a little about yourself as well.
Yes, well, thank you very much for inviting me to be on the show this evening. My name is Donna Pomerantz, and I have been living in residing in the city of Pasadena for over 17 years. I am a person with a disability, multiple disabilities, also as a result of a car accident that I was in a number of years ago. My primary disability is blindness. I am a woman who is Latina, and I would say that I was born into advocacy. Throughout my life, I would say that I've always been a person who has always been available to assist in a number of ways. My career, I have been an alternate media specialist here at Pasadena City College. I am a previous chair and vice chair of the city's Accessibility and Disability Commission. I was very honored to receive Congresswoman Judy Chu's 2017 Congressional Volunteer of the Year Award. Um, and I have been an assistive technology manager and have worked in public policy, legislative advocacy, and today I was newly installed as president of our Pasadena Host Lions Club. So I believe in giving back to the community and just being active, because it takes each and every one of us to make our community what it is for all of us today. So thank you.
Well, again, thank you all for joining us this evening, Donna. Special congratulations to you for your new appointment. And certainly each of you is very, very knowledgeable and experienced in this field. As I mentioned at the beginning of the program, certainly the inspiration for our show was the COVID-19 pandemic and everything that has happened as a result of that, the social distancing, the complete change in lifestyle. And so, as is now sort of become a tradition with our show, we generally like to ask each of you to discuss a little bit about how the pandemic has directly affected each of you. I guess we'll begin again with you, Allie, if that's all right.
Sure thing. Well, certainly working from home is new. I feel really fortunate, however, to have a job and be able to continue to serve the community through the work that I'm doing. The type of work I'm doing hasn't changed too significantly, but the lens through which it's occurring has. So as I mentioned before, a lot of what I do is provide technical assistance to my colleagues on accessibility issues. But now, instead of it being about maneuvering clearance at a door to a bathroom, we're talking about providing access to street dining that's being set up to facilitate social distancing for restaurants. So it's been really interesting to see how the content of the work that I'm doing has been affected by COVID and the city's COVID response. So I would say that's been the most significant impact, is the content of my work and then working from home, for sure.
All right. And Martin, if you would share your insights too, please.
Yeah, actually, when all of this started to sort of snowball in the early part of the year, in mid-March, I was on my way to Phoenix to watch spring training baseball with a couple of old friends. And we were halfway there to Phoenix when we realized that the country was beginning to shut down. So at that point, all our lives were sort of obviously thrown up into the air. Prior to that, just as a sort of a note, but it's hard to know for certain, but one of our sort of basically, City of Pasadena citizens who was a great advocate for people with disabilities, Robert Gorski, had passed away, a friend of the station I know. And he died in late January, and no one quite really knew what the cause of death was. He had been to a meeting, he sort of had felt a little bit ill, he went home, and over that weekend he had passed. So I think, to me at least, without knowing the bottom line on that particular story, it affected me very heavily because Bob meant so much to our community. Personally, for our family, and so it's sort of a family take on this, my daughter has an apartment in Pasadena, but in the evening she comes home. So she's in and out of our house. She requires full-time attendant care. So right off the bat, you're trying to begin to do this little dance that we're all doing, where it's all about risk management. Are the personal attendants healthy and protected and mindful? Is Eva protected and careful? Because she is going to be so close to her personal attendant throughout the day. So that's a big major deal. And you feel as though you're taking a risk and you never quite guaranteed that it's going to fall in your favor. So that's one area that became very important to our family, to try to figure that piece out, as I think lots of people and families are trying to figure out. The other thing, and we'll get into it maybe a little bit further in the show, but with regards to the Black Lives Matter movement, I have been someone who naturally would go to political protest marches. And so for me, when all of that began to break in the middle of this COVID, there was this conflict in my mind as to whether and how, as you know, I would participate. And long story short, in the middle of June, I finally decided to go to a march. And we can talk about some of that later. But the point there is that by me taking that risk, when I came home, I had to quarantine myself because I took a risk that I was willing to take, but not necessarily a risk that was fair to either my wife or to my daughter. So the point I'm trying to make there is that the biggest change for me with all this COVID stuff relative to disability is risk management. What is safe, what isn't safe, and that changes on a day-to-day basis. So it's confusing.
All right. I can certainly understand that. Donna, how about you? On a personal note, how has COVID affected you?
So on a personal note, it really has affected me in the sense of, you know, as a woman who is blind, you know, I rely a lot on public transportation, the buses, the trains, paratransit services. You know, it's and the assistance of other people when, you know, shopping, going and buying groceries, things like that. And now, you know, I truly feel that uh, my ability to get around for the first time has truly been hindered in that sense because I really need to be very, you know, concerned about, okay, you know, distancing. And so we're very fortunate to be living where we're living because there are many things around us that we can walk to. So if we go and purchase groceries, we'll, you know, walk over to one of the grocery stores several blocks away, and then, you know, we bring them back because it's not as easy, you know, to deal with the public transportation and such to get to different places as it used to be. So we really have to plan a lot more. We're not able to be spontaneous. We have to be concerned about social distancing. You know, we don't know if others around us are, you know, wearing their masks or anything like that. And, you know, when going and purchasing groceries and things like that, you know, the stores have their policies in place to keep their employees and all of us safe. And, you know, the fortunate thing is that, you know, folks do know us. So, you know, we're able to tell them how to provide us with assistance and things like that. So it is a little bit, it really has changed a lot for myself personally in the ability to get around.
So, would it be fair to say that you would describe living in the age of COVID to be more of a disability even than the loss of sight?
Oh, absolutely. Because, you know, having been born as a person who is blind, you know, the only thing that I can't do is drive and, you know, things like that. But being fortunate to live where we live, everything else was always possible. And so, you know, I truly do feel that my life has been impacted as a result of, you know, of COVID. I do have underlying health conditions. So, you know, that's the reason for the caution as well. And I haven't seen my parents by choice because I need to go out and buy groceries and go to the stores. And I don't want to take the chances that I may have it and not have symptoms and pass it on to them. So life has definitely changed for me personally, yes.
Well, we certainly do appreciate your insights on this. The COVID-19 pandemic has certainly created challenges for everyone, not the least of which, of course, as we were just discussing, is the fact that most of us have returned to a lifestyle where we are pretty much cooped up all of the time at home. It certainly, at least the medical professionals would tell us, it is the safer choice at this time. But I'm wondering if there are challenges that are unique to the disabled community with respect to COVID. And if there are, I was hoping that each of you might take some time to help enlighten us on those challenges that the disability or disabled community faces.
I can jump in on that, and for in my point of view, a lot of this is best understood in terms of nuance. So the COVID-19 virus has affected all of us across the board, obviously, in a sort of a general major way. But then if you begin to sort of narrow that down and think about these questions relative to disability, just take what Donna was saying there in terms of going to a store. If you're a person with a disability and maybe somebody that has a mobility issue, then you have to think, okay, I'm going to go to Ralph's. How am I going to get to Ralph's? When I get on that bus, what risk am I taking in terms of my personal safety? When I get to Ralph's, am I going to have an accessible, easy experience in the store? When I leave Ralph's, I have to go ahead and take that bus back, which means that I can't take 3 packages of Kleenex or paper towels. I only can take 1. So the point I'm making there is that there are all these nuances that you really wouldn't even think about unless you had a disability. But if you have a disability, it just kind of just impacts on so many different levels that you you have to be pretty creative and pretty flexible and pretty resilient to get through some of that stuff. So that's just one example, but just think about that. You know, if you're going to the store or you have a personal attendant and that personal attendant's been out on the weekend and now is coming in on a Monday morning, has that person been safe? You know, there's just one little, and I'd love to hear Donna and Allie's take on that as well, but there are all these nuances that really shape the experience.
All right. Well, thank you. Yes. Hopefully, Allie and Donna will also chime in here.
Well, there absolutely, there absolutely is a lot to think about. We do have someone who comes in maybe every other week, to read mail to us, that we're not able to access on our own, and, assists at times with other things. And so, she is a part, of our small circle. And I do have someone who comes in also every other week who assists with, things around the house, because there may be things that I don't see and so on and so forth. And, both of them have assured us that, they're not going out there practicing safe, social distancing and all of that. And so in that sense, I'm taking them at their word. However, as I shared, I just choose not to, possibly expose people who have, who are in those high risk groups, because, it's not just me. I'm exposing myself to different people as well. So it's definitely life changing. And when we go out for a walk, my husband and myself, because he's also blind, when we go out for a walk, we have our masks and, we're walking and we use white canes. We have to, take into consideration that hopefully people that are coming upon our path, they'll distance themselves because, we're not able to see them coming, but we still need to get out and walk and move around. So it's definitely a community thing.
All right.
I would just add that when thinking about disasters, which COVID qualifies as one, and people with disabilities, we know from research that's been conducted after all previous disasters that people with disabilities are disproportionately impacted. It's the way it always is. It's the way it is right now. So Marty and Donna, I think, are both talking about the risk assessment component of that, at least in part. And, just thinking about how that changes the processing and decision making for each unique individual and their unique needs. I think has a bigger impact than on their lives and day-to-day interactions with the world than somebody who doesn't have a disability. And then I also think about the folks who don't have are given the opportunity to make those decisions for themselves. So thinking about individuals with disabilities who live in group homes or live in institutions, and so the shelter in place where, we're talking about when we venture out of the house or thinking about who might be coming into our house, there are members of of the disability community who haven't left their homes in 4 months and possibly haven't even left their rooms in 4 months. And that is a big deal if you think about it, because there's so much more freedom that's allowed to folks who don't have underlying health conditions. And so there's the one aspect of it where folks aren't, don't have that ability to leave. And then there's the other where that they're being told, they're seeing everybody else start to have these more flexibility and freedom in the community. And, I think that's tough for a lot of people, and particularly difficult for folks, for example, who might have developmental disabilities and don't understand why there's the need for safer at home. And I've heard a few stories of individuals who think that they've done something wrong, and that's why they're unable to see their families or leave their homes. And so each person is going to have a different experience, and the disability community is diverse, so those experiences are diverse. But the bottom line is that the community is disproportionately impacted by this disaster, just like any other disaster that we experience.
I just wanted to add on to what Allie just said there in terms of families. In terms of the developmental disability community, where families might have a child or an adult child still living at home, their day-to-day sort of routines are very structured for all sorts of reasons. But if you think of a family with maybe a child that has autism, that routine that maybe has been established over years is very critical to sort of keeping the peace. And once this COVID virus, and I was just talking to a mother yesterday, she knows of a family where the child had a massive sort of outbreak of aggression and really attacked one of the family members and wound up having to be hospitalized and then prescribed to Thorazine. Now that's kind of a dark story, not kind of, that's a very dark story, but it's not surprising to hear because one piece is jarred. And as Allie was saying, some of these individuals might not understand why they can't go to that day program they've been going to. And it creates a tremendous stress on a family unit.
One of the things that I wanted to share is, folks who are blind or visually impaired, there are a number of folks who are, they're using technology to, have things delivered to them, Amazon or, the Ralph's or Kroger or, the various apps, Uber Eats and so on and so forth. So, folks are being creative in that way. Those who are able to afford the smart technology or have the internet to be able to do that. But some of those grocery delivery services, you have to wait quite some time to get what you need delivered to you if you're not able to leave the house. And sometimes that has really caused a hardship. I was very, pleased when, in our walk, we found a pharmacy that's about 2 blocks away from us, a little family pharmacy. And because in the very beginning, I was just so stressed, where are we going to get masks? Where are we going to get masks? And we went to this family pharmacy and they sold masks. So that's 2 blocks away from us. We're very fortunate. Not everybody is that fortunate. Some of the things that are being done for the senior community, if they are able to get connected to having meals delivered to them, they're putting masks in that meal packet as well, so that they have, the different masks and things like that as well, which is a wonderful thing. But again, not everybody is connected in those ways.
All right. Well, I definitely have several questions that I'd like to ask, based on your responses to some of the earlier questions. But before I do that, I would like to point out that, again, if you are watching on Tuesday, July the 7th, our program is live and our phone lines are now open. So if you'd like to call in with a question or comment, you can do so at area code 951-356-6882. Again, that's 951-356-6882. If you are watching us on the Zoom application this evening, you can certainly submit your question via the chat. And again, as mentioned earlier, you can always submit a question at any time via email to arroyolive@pasadenamedia.org. Okay, going back to our discussion, and I apologize for the interruption. One of the things that you mentioned earlier, Donna, of course, is that people with disabilities often have underlying medical conditions, health conditions, that often require ongoing medical support. Does the COVID virus affect that? Do you find, and again, I do submit this question to everyone on the panel, but I started out with Donna because she did mention this in one of her responses. Do you find that people in the disability or disabled community are avoiding seeking that continuing medical care as an attempt to stay out of medical facilities and hopefully keep themselves from getting COVID?
There's a definite fear, and again, the disability community is just as mainstream society. So you do have different people in the disability community that are absolutely terrified, hoping that their underlying condition doesn't get exacerbated, because they absolutely are terrified of possibly getting that exposure. Some people in the disability community have said, I hope that everything stays stable, because if it doesn't, then I don't want, quote unquote, a death sentence. There are other people in the disability community who, get to the point and they basically say, okay, I need to go in, I need to get, treatment, I have to go into an emergency room. And, there are some people that they get treatment and then they're sent home right away. And some of those folks are really concerned about that. There are other folks who, if they do go in and get treatment because of COVID, their attendant or their advocate or their family member isn't, always able to visit them. I know that policies and legislation has changed a little bit, but a lot of the providers still are not letting a companion, an attendant, go with the person with the disability. So when they do have to go into the medical system, at times they're much more isolated because their family member or their attendant or their assistant has to leave them there and they cannot stay. So it truly is a difficult situation. Even if you attend and need to go for appointments, a lot of times, the policies of the medical providers, and I understand all sides to it, the policies of the medical providers are, don't bring anyone, you must come alone unless absolutely necessary. So sometimes that deters some folks as well. And other folks who, are a little more feisty will go and say, I have to have my person with me. So again, it's different just as in mainstream society.
And the only thing I would add to that is that in the case where maybe the individual has a communication impairment or need, and that would be our experience. So my worst nightmare is that my daughter could be infected. She's healthy. She's usually she's probably healthier than I am, but because of the limitations of her lung capacity, she could go from healthy to sick, quite sick, fast. And in that situation, if her mother or I were refused access to her when we dropped her into the hospital, she would have no one to facilitate her communication. And that's, again, also true with lots of families where autism is an issue. The thought of going into a hospital with your son or daughter not being able to communicate or have facilitation of that communication is just a nightmare.
Well, I want to preface this next question by saying that certainly no one on our panel this evening has a medical degree. Nobody here is a doctor or a nurse. But I thought I would ask, based on your experiences, are there steps that you have learned about that you or that anyone can take in the event that they do need to seek medical treatment and do need to go to one of these medical facilities? Are there things that people can do, and perhaps not even just those with disabilities, but in general, that people can do to try and mitigate the risk and perhaps make themselves feel more comfortable to seek that medical treatment before a situation becomes exacerbated?
Well, one of the things that Donna talked about a little bit earlier is transportation. So a number of people with disabilities utilize public transportation. And one of the services that the city of Pasadena offers is Dial-A-Ride, which is door-to-door service. You have to be eligible for it. So during COVID, what the Pasadena Transit has done is essentially temporarily enrolling individuals with disabilities, even if they were not previously a Dial-A-Ride client. And through that, we've been able to expedite the registration for folks who needed transportation to healthcare appointments and were concerned about the safety of taking a bus for a variety of reasons, or utilizing their existing methods of transportation. And so I know that's not the whole answer to your question. I'll let Donna and Marty weigh in, but that's one way that the city's been able to help facilitate access to essential medical care for folks with disabilities.
Well, actually, Allie, thank you for taking the lead on this, because we do certainly encourage everybody's insights on this. So we really appreciate that.
I think that, I've had to go to some appointments, just, regular standard medical appointments. And I truly believe that the providers who are there on the front lines are just, doing everything they can. When I, go to a medical facility, they have the lines for the social distancing, they take the temperature. We have our masks, there are just different things like that I think everybody has just been very, and they're doing things, making sure to keep tabs on how many people are inside the building at one time. I think our medical providers really are doing a lot. And what I've done is, I've come back, in a sense, I've been like the scout, and I'll come back and speak to other people in my community, and just basically say, hey, I went to such and such for an appointment. Oh my gosh, how was it? And, and I'll share with them. It's that communication piece, what they did and, how they, worked, with us and everything. And, sometimes that's made people feel better, because you definitely don't want to let things go. You still need to, keep up the things you need to do for your medical conditions. But I think it's imperative to those of us who are out there to be ambassadors to those who are still inside, isolated, and not having left, because sometimes it's that communicating of what my experience was when I went to my medical provider and how they changed things, and the assistance and the promoting social distance and being very cognizant of that while still allowing you to get your treatment. And that helps people sometimes as well.
And Joe, the only thing I'd add to that, and your show is doing part of it, is to sort of create this conversation, because what Donna's just talked about is anecdotal in terms of her circle, but maybe things like the commission and what you're doing today can sort of amplify that, because we're sort of making it up as we go. The other thing that Donna mentioned, which I think required, it warrants, emphasizing, is advocacy. And, some people are better at that than others. But if you wind up in a situation where you're trying to reach out for medical care, you'd be surprised how much, you can get if you are very clear and demanding. And sometimes people don't like to nurture that part of their personality, but sometimes you just have to be wicked and make sure that people understand that the risks that are at play need to be attended to. Sometimes you'll win, sometimes you'll lose. But I think having this conversation is critical in the months ahead. We've got a lot of work to do.
All right. Well, I'm certain we've all seen the reports in the media that the situation with the COVID pandemic is not getting better. There had been hopes early on that as the weather warmed during the summer months, perhaps we would see a die down in the infection rate, much the way we do with the flu and the common cold. And apparently that has proven not to be the case. In fact, in some areas, we're seeing quite a resurgence. Martin, I believe it was you who said earlier that dealing with COVID, especially when you are talking about the disabled community, it's nuanced. And Donna, you referred to people with sight impairments having to basically go on the honor system, that people are social distancing. I'm wondering how you feel the effect is from all of the people that we have seen in recent reports who are bucking the trend in terms of wearing face masks. There are many people who are arguing that it is an infringement on their rights to be forced to socially distance themselves and or wear these facial coverings. How does that affect the disabled community?
Again, as I said, we're a smaller version of mainstream society, and I'll be the first to say that I haven't gone out walking as much as I have because the mask is very uncomfortable. It's hot, and it's just not comfortable. But there are a number of us in the community that have basically said, okay, let's do it. We need to take care of ourselves and, try and take care of those around us as well. And there are others in the community that basically say, oh, look, things are changing every day. First they say one thing, then they say another thing. And so, there are others that, don't necessarily think it's as necessary. So, we're just as everyone else is in society. But I think, the difficult thing is that once it touches you directly, whether you're a member of the disability community or mainstream society without a disability, once it touches you directly, then it really is just very real. And there are a number of us, because we know that there's possibility of being asymptomatic, that, really if there's any doubt within us, what really causes us to wear that uncomfortable mask or, make sure to wash hands constantly and all those other things is the fact that, we don't want to unintentionally give it to someone who's more vulnerable without knowing.
Yeah, I say that argument. I have no patience for that argument whatsoever about liberty or about my rights. This is the public good. This is a public health issue. I say if you have a power wheelchair and you see somebody without a mask, run them over.
That's quite extreme, but I think it does get the point across.
Yeah, I'm making that point, and I am being, a little smart alecky about it. But the point really is true, is that I wear my mask because I want to send you a message that I care about you. And I'm hoping that you care about me. And if it's uncomfortable, well, we're all in it together here. We're not alone. This is not about the First Amendment. This is about public health. It's not complicated.
And I would just add to that there are some reasons why somebody with a disability cannot wear a mask. And those reasons if somebody can't wear a mask, they do need to still be accommodated in other ways in order to be able to access the goods and services of the business or the programs and activities of the government entity. So the conversation or the politicizing of the mask wearing sort of gets in the way of being able to deliver that message in a meaningful, constructive way, because there are people out there inappropriately citing the ADA as a reason why they don't have to wear a mask.
Oh my God, I haven't heard that one.
Yeah, but that doesn't that doesn't eliminate the fact that there are people with disabilities who cannot wear face coverings, and we're fortunate here in California that the California Department of Public Health, when they released their mask guidance, included those various types of disabilities. So initially what the messaging was only if, it was a respiratory issue or some very limited examples of disabilities that might make you exempt from the face covering requirement. And the information that was recently released included people with behavior disabilities or perhaps with autism that cannot wear a face covering for reasons other than respiratory disabilities. So I think that it's important for when recognizing the fact that wearing a mask is a public health issue and that it's extremely important for all of us to wear them, that's all of us who can, so that those who cannot can still be out in public in a safe way and practice social distancing without being ridiculed.
Right. And Allie, I think just to expound on something that you mentioned a little while ago, there were reports in the media a few weeks back now, I believe, that evidently there were various websites that were issuing cards that you could download and print that claimed to be from the ADA, and you would then insert your name into these cards, and it was supposed to provide you with some legal excuse for not being required to wear a mask in public. I believe that's what you were referring to.
Yes, and the Department of Justice issued a statement saying that those were not legitimate. Interestingly, on a similar note, there's no card or proof required for a service animal either, but people make a lot of money selling those as well.
Now, you don't want to get me on that one.
All right. It sounds like something to avoid for sure. I want to change the topic just a little bit and move along in the discussion. Certainly, from an employment standpoint, we have seen a significant loss of jobs across the country. I know that it has always been, and I hesitate to use the phrase, but I will anyway, an uphill battle when it comes to people with disabilities finding employment. Has there been a significant loss in the few jobs that seem to be readily available for those with disabilities now? Is this become an even larger crisis on that front?
I think it's too early to tell. I mean, this is such a huge issue for the disability community in terms of opportunity to employment. And I think it's we're just going to have to see how this impacts that. It was such a huge problem before the virus that it doesn't surprise me that the virus has just simply made it even worse. Maybe Donna, you have some thoughts on that?
Yeah, there are a number of folks, and that is absolutely true. There are those struggles. We know our employment statistics, are not good. I mean, so many people in our community are unemployed even before, COVID. However, there are folks in the disability community and folks who are blind and visually impaired, physically disabled, who, their employers have really had to be creative, and a lot of people are working from home now. People are saying, gosh, the Zoom meetings, the teleconferences, everyone's having to, just as Allie shared earlier, with her job, she's still working a lot, but she's doing it from home and she's doing it a little bit different. So those people with disabilities who had employment before the virus, there are a number of people who are working from home because technology can be very accessible for them. And, it's working out, although it's frustrating for some of them because, now they're at home all the time. So, but it definitely has its, we have a whole national convention of the American Council of Blind. People come from all over the states, who, would come to a convention, and that convention is now, as we speak, being held in over 100 Zoom rooms. So people are participating all over the world through technology. So technology has opened some doors for folks related to employment who've been able to keep their jobs.
Yeah, and I'm glad you touched on that, Donna, because there are a few opportunities that have been created by COVID, and I think that that's a really important one to highlight. A lot of people with disabilities who have previously requested telework options have met with resistance, just kind of generally across the board, not speaking about one specific industry or company, but there has been resistance in the past. But now that everybody is having experience with remote work and seeing that it is possible, I think that it will create more work opportunities for people with disabilities. Of course, I think what Marty was talking about before, though, is important to acknowledge that with any sort of budget cuts that cause a reduction in the workforce, people with disabilities, particularly part-time workers with disabilities, people with intellectual and developmental disabilities who have positions through job training programs, I think that they're some of the first to feel those impacts.
Oh, those are important stories that we should share. We should figure out ways in which that opportunity, can be shared with others.
All right. Well, we certainly do hope that more opportunities are created. Moving on, we do have a question that was proposed to us through the Zoom chat, and it's from Dan. He writes that I really appreciated Robert Gorski and his work in Pasadena. Do any of you on the panel have any special memories about him? And he also wonders if anyone would care to posit on what he might be working on during the current COVID pandemic.
Well, I got to know Bob when I came on the commission. I actually had known him a few years before that when I was at the regional center. So I knew who Bob was, and I read about him and saw pictures of him. So when I got on the commission, he had already retired, but he continued to participate and support the commission and its work. So we would go every so often to Conrad's, which is a restaurant in Pasadena, which was kind of one of his watering holes. I always liked to see Robert. He was always positive. He had a really interesting professional history, which included being a managing editor of Disabled USA back in the 1970s, which was a great publication that was part of the whole disability rights movement. So it was a shock to our community when we found that Bob had gone.
All right.
So if the pieces hadn't been put together, I took over Robert's job after he retired. So I have the pleasure of finding his notes and all kinds of different things that he worked on during his time with the city. And those of you who know Robert know that he's pretty creative and has a good sense of humor. I tend to fall more on the boring side of things. And so it's always fun to, be working on something that I'm looking at it very linearly or from a statutory perspective. And I'm looking through old files and find, some funny note from Robert about whatever the issue at hand is. So I appreciate, that levity to my job. And also he provided training. So I'm really grateful for the help and support that he provided when I assumed the role, and agree with Marty that it's a big loss to our community that he's no longer here with us.
Yeah, Robert definitely, from a number of stories, definitely had a very long history as an advocate in the disability community. His roots, of course, were independent living. And, there are a number of, interesting stories that, come as a result of that. Robert was staff he was my staff when I was commission chair, and we had, we had, some very interesting interactions, and he was definitely very knowledgeable and knew the city, and always knew what was going on all over the place, and was always willing to share that. So it's definitely sad that that he has passed away, but as I was sharing, the last time I saw him, I noticed he was already having struggles. So that's what the condition does. So, yeah.
Well, this would be one of the few times in our conversation where I actually get to chime in with something of my own. My connection with Pasadena media goes back a great number of years, and I first was introduced to Mr. Robert Gorski through another gentleman by the name of James Wagner, who was doing programming for Pasadena media at the time. And that is when Robert Gorski came in, and the two of them worked side by side on a number of the programs for the channel, and they had great fun together. It was wonderful to see the passion that they both shared for this work and for the community. And I know that in very recent times, we had just established, just before COVID, a podcast studio within the Pasadena Media facility. And Robert Gorski was very much looking forward to beginning to utilize those facilities. He had great plans for a podcast. Unfortunately, the COVID situation brought everything to an end. And of course, his passing also brought all that to an end. But I had certainly looked forward to seeing him and all that he was going to accomplish with that medium. Moving on again, we're in the closing minutes of the show now, but I wanted to make sure that we got this in before the end of the show. Each of you figures very prominently in an organization here in the city that deals with folks with disabilities. And I was hoping that each of you would take a moment to speak a little bit about community involvement, or how the community can get involved and how they might help, and where they could go if they would like to do those things within your organizations.
Who's going to go first?
You know what, Martin, we're going to have you go first. How about that?
Oh, okay. Look at that. I always thought I was going to get off on that. Well, actually, I thought about this relative to the questions that you had shared with us beforehand. And, locally at the commission level, we're hoping that as we go into our next work plan, that we can all take a step back and prioritize some of these needs relative to both COVID-19 and Black Lives Matters. We didn't have a chance to talk enough about that today, but with regards to some of the resources that are out there, if you go ahead and just Google some of this stuff, you're gonna find a lot. But there's a Black, Disabled, and Proud, which are college students with disabilities. If you just simply go ahead and plug that in, there's a really great site in terms of trying to figure out how college students with disabilities are going to address what happens in this social upheaval. There's a website called Autistic Women and Non-Binary Network. So there are people that are actually coming out organizationally, wanting to make sure that their voices are heard, because this is a very rare opportunity for us. And I'll leave it at simply saying that one of the things that is important about disability culture is its history. And the disability rights movement, which led to the Americans with Disabilities Act, which is going to have its 30th anniversary at the end of this month, that was a long road. And the people on that road made sure that they were able to negotiate and collaborate and find common ground with other communities. And the Black community and the disabled community share a lot in common. So short of being in despair, my hope is simply that we will all go ahead and recognize there's a lot of work ahead of us. But if we do it together, maybe this will be a remarkable time as we come out of this horrible nightmare. That's my 2 cents.
Yeah. I think, I think there are opportunities all around us. Whether, and everyone has different gifts. Everyone has different strengths. Some people you know, can get out there and be heard, and other people make a difference in a more, in a more quiet, direct way. Whether you choose to serve on, commissions, whether you choose to, get involved in, philanthropy, whether you choose to, even just start using all the services that are around you. A lot of times, we're really able to make that difference one on one. It's just surprising to me, on a personal level, that in this day, there are still some people who are totally blown away when they find out that my husband and I are going out for walks by ourselves. Or because they're not used to seeing people with disabilities just doing their thing like mainstream society. So wherever you go, there are opportunities. Serve on, volunteer. Um, there are many committees, transportation advisory committees. Go to those meetings, find out what they're about, see if you fit, get involved in, membership organizations or advocacy organizations as a member in the grassroots, and see if you want to do more. There's just so much in these days now where people could really make a difference, one person at a time, whether you're out there in the front or whether you're, a worker bee helping keep things moving. There's a lot.
I would just add to that now it's even easier to engage with particularly the city council and city commissions and committees, because the meetings are all of the meetings are now live stream. And so you can watch and, from your home, if it was at an inconvenient time previously for you to get to council chambers, there's a greater opportunity in order to listen, understand what's going on, and provide critical and important feedback. And I think as we consider the issues that our community faces as a whole and how they impact people with disabilities, it's really important to hear from people with disabilities and to center that voice in the conversation. And so it's great when the disability community is providing their feedback and engaging in a number of different ways, so that voice is really present and it becomes an important component of the dialogue.
All right. I just had one really quick question, and we really don't have any time for this at all, but is there jeopardy of funding being cut as a result of COVID? And again, we only have a few seconds for this answer.
Of course.
Yes.
Okay. So definitely any way that people can volunteer or donate would certainly be appreciated.
Yes.
All right. Well, Miss Allie Everett, Mr. Martin Sweeney, and Miss Donna Pomerantz, thank you so much for joining us all this evening. We really appreciate your insights and your expertise on this discussion, and hopefully we can discuss this further on another show. To our viewers at home, if there are topics you would like to see addressed in our discussions, you can email them to us at arroyolive@pasadenamedia.org, and we may include them in a future broadcast. This has been Arroyo Live. Thank you for watching, and good night.
Thanks, Joe.